Good afternoon, everyone. Thank you for joining this webinar on being trauma-informed and responding to COVID with compassion. My name is Megan Georgia and I'm the Programme Manager for the Quality Network for Prison Mental Health Services at the Royal College of Psychiatrists. Today we have Dr. Sunil Lad, who's a consultant counselling psychologist for Northamptonshire Healthcare NHS Foundation Trust. Any questions that you would like to ask Sunil throughout the session, he'll be taken as and when throughout his presentation. So you can put those through the chat function that's at the side of your screen. Any questions that we may not be able to answer today, we'll be able to get back to you after the session, but we'll do our best to get through as many of them as possible. Just so you're aware, we will be sharing this recording after the event. It will be going live on our website, so if you would like to share it with any of your colleagues or you'd like to watch it again, you'll be able to do that. So we hope you find the session useful, and I'll now pass it over to Sunil. There you go, Sunil, you should be live now.
Lovely, thank you, Megan. So afternoon, everyone. I hope you are all very well in this very unprecedented time. So my name's Sunil, I'm Counselling Psychologist with Northamptonshire Foundation Trust, and we have about 7 prisons. So in terms of today's presentation, I'll be talking about my experiences generally over the last 6 weeks that we've been going through at the moment. And so, yeah, just a few acknowledgements before I start, really. So I firstly wanted to thank all the secured services staff within NHFT, just because they've been doing a great job, but also I've been thinking about what they're going through in order to form my presentation today. Also, the psychologists within secured services, as well as the wider trust. I think one of the things that we've really recognised is that support is absolutely essential, and it's really helpful for me to be meeting with my colleagues on a weekly basis, talking about some of the difficulties of what COVID is actually presenting with us to us, so then we can work together to really think about how to have a team approach for this. I'd also like to thank Professor Paul Gilbert and the Compassionate Mind Foundation. So Paul's done some excellent talks, and I've got a link at the end of the presentation. There's some really good material for a couple of hours actually, but he shared his slides with me today, so I'll be sharing some of those today. Also, the BPS, they've done some excellent talks on thinking about how do we protect the psychological well-being of healthcare staff during the pandemic, and also Dr. Steve Jeffries, who's kind of created this really nice cognitive analytic framework of understanding this pandemic and some common responses that we've been finding. So towards the end of the today's presentation, I'll be kind of thinking about how do we have conversations about the struggles that people might be going through at the moment. So in terms of the presentation, what I'll be talking about is recognising how we're built, so really describing an evolutionary model of humans, and as a result, when we're faced with trauma, how do we respond? And then the second part of my presentation will be about how do we compassionately respond to not only our staff but also the residents in our care, because there's different things that we need to do in order to make sure that we continue to provide good services at this moment. So one of the things we really need to acknowledge, and I guess we titled today's presentation as the trauma population, being trauma informed. And I guess one of the things that we really need to acknowledge is that within prisons, we work with a big cohort of people who've experienced high levels of adversity, especially in childhood. And we know the research coming out is telling us that actually, if you've got a high ACE score, then actually your chances in life are going to be limited. Your health outcomes are going to be poor. On top of that, we know there's also high levels of poverty, social exclusion, and attachment difficulties. All of those experiences put together are likely to affect how someone responds to the world, and I'll be talking a little bit about that this afternoon. So one of the things we really need to appreciate and understand is evolution. So if we think about our brains, our bodies, our minds, they're actually built in this way because evolution has built them in this way. So we don't actually have a choice. We don't have a choice of where we're born. So I was born in the UK, whilst my family are from India. I didn't have a choice of where I was born. Actually, on top of that, we've all got a brain and a body that experiences anger, sadness, fear, joy, and lust, and a whole range of different emotions. Again, we do not have a choice. They are within us, and certain contexts and situations will allow those emotions to come through. And then also, you know, how many fingers, how many lungs, all of those things we're born with, we do not have a choice over. And I think that's a really important thing that we need to think about, especially when we're thinking about trauma, because many people did not have a choice for what they've been through. So we also need to think about a biopsychosocial understanding of human behaviour. So we know that our genes influence our personality. They influence whether we will be prone to certain diseases, but also our environment kind of shapes how we grow up. And we know there's lots of research coming out in terms of epigenetics that tell us that actually our environment will also affect our gene expression. So one of the things that we need to think about is actually, how do we survive? Well, we survive in the best way possible given the circumstances that we go through. So if you have limited circumstances, you might have limited ways of coping with life. So we've got to be really honest right now that actually we just find ourselves here trying to do the best that we can, wanting to be happy generally and to not suffer. Unfortunately, sometimes when we try to cope in the best way possible, it means that our suffering just continues because we don't know any other ways of coping. So if we think about our emotions, we can generally break them up into 3 different categories. So we have different emotions, and firstly, so we generally have a threat system. Our threat system kind of dictates our body to direct our attention towards surviving, really. So avoiding any threat, any danger. So that's also the fight, flight, freeze response that we'll experience. So for example, if a lion walked into this room now, I would hope that my threat system would come on, which would allow me to jump out the window just now. And then we've got the second system is about drive and excitement. It's also about kind of getting resources necessarily for life. So without it, we wouldn't go to work, because actually what work allows us to do is to get money, get paid, and to continue to live. So as a result, I can then go and buy food, which which allows me to kind of live my life in a way. So and we always feel good when that particular system is activated. So we feel good when we've got money because it gives us opportunities. We feel good when we've achieved something. It sets off the dopamine in our body, which kind of feels good. And then we've got the rest and digest system. So that's just when we're feeling good, we're feeling safe, we're feeling connected. So all of those 3 systems will lead to very different experiences within our bodies, within our minds, and our behaviour. So then, if a nice diagram that Professor Gilbert has created is the 3 systems diagram. So if we think about the drive and excitement system, it's about going and getting things, acquiring things, consuming things, and we feel good. So kind of think about, for example, if you've had a really good day at work, your drive system will be on afterwards because you've achieved something. Then we've got our threat system, and that's about defending ourselves. And that's associated with emotions around anger, anxiety, disgust. They're there to protect us. And then finally, we've got our rest and digest system, which is also about feeling safe, connected, content. And it's that which we can start to use that will create a more compassionate environment through making changes for people. So at the moment, what we're probably finding within the system is that these 2 systems are generally on quite a lot. So we're trying to achieve, we're trying to get good results, but also we're in our threat systems because there is a danger out there. This virus is causing high levels of death, and therefore, as a result, what we're needing to do is socially isolate ourselves. But we're doing that through kind of thinking about different solutions in order to do that. So if we think about our minds, we kind of see our minds like a bit of an algorithm. So for example, if a predator comes, then it activates arousal, and as a result, we run or we hide. Or if we got food, then we approach and we try and get that food. But as we're getting that food, actually what's happening is our body is reacting by salivating, which will allow us to eat that food and digest it. Or also we know that, whilst I've put a simple diagram on, it's not always that simple, because actually our behaviour will be affected. So for example, when threatened by someone who might be more powerful over us, rather than fight, we might submit. But I guess coming back to our understanding, a more trauma-informed understanding of life, what we've got to remember is that if you've had lots of experiences where you've been threatened and suddenly you've learned, no matter who that person is, that you fight back, you get protected. So that's when we often see violence happen in prison. Whilst staff might be more powerful because they've got keys, because they've got other staff around them, actually at times people do rebel. And again, there's a different algorithm related to that. If we look at the studies done by Philip Zimbardo, they're really interesting studies to think about in a certain environment, in a certain context, what our minds do. So our brains, if we think about our three systems, generally with any kind of danger, our threat system will come on. Because actually, from an evolutionary perspective, it's really important we see any danger, because otherwise we will be that lion's lunch. So what happens is that we develop a negativity bias within our brains. So if we think about our brains, what happens is that we run along this principle of it's better to be safe than sorry. So if we look within the prison environment, what we kind of start to see is that people jump to conclusions. Sometimes they might be grounded in facts, but one small problem becomes a huge issue. So we often see people who aren't necessarily presenting with psychosis, but who might be extremely paranoid. They don't meet the other criteria, but actually because they've spent so much time thinking, and that's the amazing thing about our brain allows us to think, and what happens is that we jump to conclusions, so they're fact. We get confirmation from our body because it feels so overwhelming. So actually what we do is that we focus all on negative. This isn't our fault, it's how our brains are designed, but we've got to really acknowledge that it's a problem. And we both as staff within the prison system, but also we see this within the client population. What happens is that we jump to all sorts of conclusions, and I see this in risk assessment sometimes as well. We make, if that happened, then it must have, the reason behind it, the motivation must have been this. But actually what we need to do is step back. This is both our negativity bias that we see, if we think from a security perspective, we again go down, it's better to be safe than sorry. And there's a reason for that, because actually if we don't, sometimes people will be harmed, but sometimes we don't make proportionate good decisions. So the other thing, what we need to think about is how our brains are organized. So we know that actually in one of these three systems, so we've got to also remember that within the drive system, we also might go into more of a competitive mentality. So how we think about others will be shaped by one of three systems. So whether we're caring towards them, whether we're competing towards them, or whether we feel threatened by them. As a result, that will motivate both our thinking of what we think about that person, how we're interacting with them, also the bodily reactions we have on our emotions, but also what are we focused on when we are talking to them. So when we're in our threatened mind, we will be focused on what is the danger, as opposed to when we're feeling more caring, we're not necessarily thinking what is the danger that this person is alerting to me, but we'll see the wider picture. So this is really important if we think about these different mentalities that we have in the brain, in thinking about, well, actually, sometimes we go into a more tribal way of thinking. That competitive way of thinking comes out. So we think about our group as people that we can get support from, but the out group are the enemy. And we see this play out in many different ways within the prison environment. So we sometimes see that with staff versus the residents. We sometimes see this as NHS staff versus prison staff. Within the healthcare departments, we might see primary care versus mental health, or also we see managers versus staff. And I think at the moment, we really need to be conscious that people are doing really different roles, but as a result, these tribal ways of thinking might be coming out, which lead to unhelpful and unhealthy ways of coping. So we also know that at times of stress, generally there's three main emotions that we experience as human beings. So we've got anger, fear and anxiety, and sadness and grief. And I guess it's probably anger that we might be seeing a lot of at the moment, and also elements of fear and anxiety. I think we as a society, but even more so within prison, often struggle with sadness and grief, unless it's something absolutely huge. So it feels okay to experience sadness and grief when there's loss, for example, and death, but other times it might be more difficult. So I think we really need to be aware of kind of the environment of prison, which is quite a macho, masculine environment. So when we have these kind of macho, masculine environments, what we have is this gold standard, what it means. And you know, one of the prisons I go into is Whitemoor Prison, and you often see people really trying to have power. And that might be by making sure that you go to the gym for hours on end to look like actually I'm invincible. And that's to take a level of control. But actually what we don't do then is that we don't allow ourselves to experience vulnerability or sadness. So one of the things that I often see is that people are really scared of feeling sad because it's seen as a weakness within the prison. So it might be that there's this assumption that people can't cope, and therefore they should never admit it. And if that does happen, what we start to see is that people start to cope with distress by denial, dissociation, or avoidance. And that might be through using drugs, alcohol to escape their troubles, or even self-medicating. And I guess one of the things that we need to really be conscious of within the prison estate is what is happening to the levels of alcohol. Well, hopefully there's not much hooch, but there might be hooch being brewed, drugs coming into the prison, but also requests for medication. So this, I saw this picture only a few days ago, and it felt like a really powerful picture that we really need to be thinking about at the moment. So one of the things that we might be seeing a lot of is the first two pictures on the top of people generally being angry and annoyed. But as we start to reveal those masks, what we see is sadness and fear, but also actually deep down thinking about understanding how people might have experienced childhoods where they weren't allowed to show that sadness. We've got this deep, insecure individual, but actually in order to survive through life, what we've got is that people have to build these masks. And I guess it's those masks which are associated with risk, which is what also we start to see when we're approached with people who are struggling because they can't sit with this bottom picture, because they don't know how to, because it might have been beaten out of them, literally. So one of the things I've started to look at within my team is that we thought about these three emotions, and actually if we break them down, how might we see them being displayed within the prison environment? So if we think about anger, for example, we might start to see high level of complaints coming. So complaints might be a way for people to verbalize their anger. On the more extreme end, we might start to see violence and assaults, hostility, and hostility might not just be the residents. We might also experience hostility amongst the staff group. Bullying as well. We might start to see that kind of behaviour as an expression, people either feeling bullied or trying to control situations through their anger. Then we've got sadness and grief. So I guess, how do we start to sit with that sadness? So people might start to feel despair, hopeless. We also see suicidal behaviour, or we might also see a request for medication because people are feeling so overwhelmed that they're feeling that they need something to contain them. And also fear. So fear, we might see high levels of avoidance. And I guess what's really interesting is that there's been a number of people that I've heard about who actually naturally feel anxious within the prison environment quite a lot. And actually, at the moment, they're okay because they're locked behind their doors for long periods of time. Now, my concern is what we need to start thinking about is what happens when this gets lifted, because actually everything's okay right now for those individuals, but when they're really going to struggle when things change again. Excuse me. So not coming out of the cell, substance misuse, and again, requests for medication. So what we might start to see both within the staff group and the residents is chronic fear for people's safety. I know initially when there wasn't there were all these questions around PPE, how do we socially distance and all of that, and also, certain staff going on to wings and the staff and the residents weren't socially distancing. So as a result, there was chronic fears for safety, especially if people haven't got PPE. Then if we also think about shifts, so if sickness rates are also increasing, certain staff might be working longer hours, and that's going to be extremely demanding. And we know sometimes that the shift patterns are extremely long, and as a result, people can't rest. I guess one of the things in terms of the literature that came out, and thinking about moral injury and things that we might need to think about later down the line, is when people have made really difficult moral and clinical choices. Now, I guess one of the things we haven't seen, luckily, touch wood, is that there's not been a huge outbreak where really difficult decisions on who got care and who doesn't get care was made. So I think we will need to think about later down the line, but if people feel they did have to make some difficult decisions, well, actually, how to support them. Bereavement, both of staff and residents, being unable to contact ill members of their family. I think telephones are a big issue. Kind of if you're locked behind your door for long periods of time, you're not got access to the telephone, you can't find out if your loved ones are okay or not. That raised high levels of anxiety amongst many of the residents, but I guess also the staff as well. Also, if you've been personally affected, needed hospital care, whether that's staff or our residents. And also, I guess, we have heard nationally of prison staff passing away, but also colleagues in the NHS as well. And we might be affected by this. And I think it's about how do we continue to offer care, but still recognise that we might really struggle with these feelings. And then again, thinking from a trauma-informed perspective, really thinking about actually what does it mean if you're stuck behind your door for 23 hours a day? Many men with historical, and women, sorry, I'm thinking about men because I work mainly with men, but actually, if you're feeling abandoned, if you've got these experiences of being abandoned throughout your life, or being punished or being controlled, you might not necessarily see that this is a worldwide pandemic, but actually you might take it quite personally and feel, here we go again, I'm being punished, I'm being controlled, especially when the messages out there haven't necessarily been consistent. So I think it's really important that we really validate that these are normal experiences to a situation which none of us expected. So I think, Megan, should we just break for any questions or any comments at this moment?
Yeah, that would be helpful. One thing you might want to think about, I don't know if you're able to make your slides slightly bigger. The audience is struggling to read the slide.
Okay. Is that better? Hopefully.
Yes, I think that would be better. Thank you. So one of the questions we have is that reports have found that self-harm rates within prisons have decreased since lockdown. Do you have any opinions or theories of why this might be?
So we started to think about that, and I think one of the discussions that I've had with my team is that actually a lot of, so whilst I'm talking about people feeling abandoned, punished and controlled, actually a lot of people have understood the situation, have understood that actually it's not about them. There's this, the staff are really struggling, and I think the fact that staff have said, you know, we can't necessarily control this, a lot of staff have tried to go over, above and beyond in offering that care. Actually, that has given those individuals that level of control, so they've not self-harmed because they've been given a number of different coping strategies for coping with their emotions. So that's my theory at the moment. I think as time goes on and we start to talk to individuals, especially those with high levels of histories of self-harm, it'll be good to talk to them and find out what actually helped them. And I think there's a lot of hope for me to think about, well, actually, let's think about using that as a learning tool and development tool of how they might be able to use that strategy in the future.
Okay, thank you. What psychological dynamics might you expect to see play out in prisons when there is growing disparity between community and prison levels of lockdown?
I guess it depends. I think within the prisons that we have in NHFT, people, there's been different ways of coping, and that's been based on the numbers of cases that we've had. I think it also depends on your population. So what are they actually being given? How have staff communicated about this particular problem? Now, if it's not been communicated well, and we've seen kind of poor relationships amongst staff, between residents and staff, or they felt punished or controlled, I guess then what we might see is that playing out where those where certain individuals or wings decide to try and control wings or punish staff back.
Okay, what about first-time offenders versus repeat offenders in prisons? Is the emotion threat phenomenon different, as the latter may be more hardened criminals?
I guess what we've got to think about is, again, going back to how have we been shaped by our environment. I think it might be that going back to this picture, actually, so if you decide to use the term hardened criminals, then in essentially kind of think about it as this mask, whereas actually someone who might be a first-time offender might be feeling more fear. So especially from a mental health service perspective, I guess I might see more levels of higher levels of presentation for those who it's their first offence, who are struggling with the fact that number one, they're in prison, but number two, they've come to prison at a time when it's not like prison normally is, and those who are normally used to prison. I guess what we've got to also think about is generally we know that regimes are quite predictable. This has led to a high level of unpredictability. We don't know what's happening on a day-to-day basis in terms of how our prisons are operating. And therefore, dependent on that individual's coping strategy, we might see someone deciding to use drugs in order to just block it out. We might see someone actually get distressed. We might see the other extreme of their distress is shown through violence.
Can you tell us a bit more about the negativity bias? How can we be mindful of it and even work to reduce / better manage it?
Yep, well, those are my next slides. So shall I go on to my slides or any other questions?
I'll ask you one more question. Do you know of anybody who is using particular measures to assess the well-being of staff or residents in prison mental health services? What measures are currently being used?
I guess the answer is no at the moment. I think I'm going to need to, I think at the moment we've just been thinking about how to keep everyone safe and doing the basics rather than thinking about research, but it's a really good question, and I'm sure there are various people within NHS England looking at this, and if not, then we definitely need to think about that. But I guess that's something we could think about within the quality network as well, couldn't we, Megan?
Yeah, definitely. There have been a couple of other questions around different populations to do with women and young people, so maybe at the end, if we've got time, we can go back to those.
Sure.
Yeah.
Yeah. Okay, so if we think about how to be trauma informed, we know that there's various principles of being trauma informed. They are about having safety, choice, collaboration, empowerment, and trust. So how do we understand this? Well, I guess for me, as someone who mainly practices compassion-focused therapy, we need to go back to actually how do we do that? And firstly, we need to define what compassion is. So compassion is a sensitivity to the suffering of and distress of self and others with a commitment to try and alleviate it and prevent it. So within this definition, there's two psychologies. There's the psychology to go and approach and understand and engage with that suffering and distress when actually normally our nervous systems are telling us to go away from it and run away from it. And what we do, the way that we do that is by looking into the causes of suffering. And that's why the presentation I've given so far is about really understanding that we've got this brain that we have no choice over. And then what we need to do is to work to alleviate and prevent that suffering and distress by working with various wisdom and skills, and that's through a dedicated practice. So this is quite complex, so I do apologise because I'm not going to really be able to go into it in just an hour, but I hope to give you a good overview of this. So if we think about compassion, this actually, in my previous slides where we looked at the soothing system, basically if we think about how we've evolved, we are a social animal. So attachment has helped us to bond, and as a result that is associated, there's lots of research to show that actually we can start to change our brain through compassion practices, and once we start to do that, we change how we organize our minds, and that helps us to deal with processing threat, engaging in more pro-social behaviors, but also it improves our well-being. So when we practice compassion, it stimulates and strengthens these practices, these processes and qualities of the mind. So it's not just about being caring and nice and fluffy, but actually it's grounded with courage. So it's about turning towards suffering and wisdom. So one of the things that we started to do within our services in NHFT is that initially our threat systems went, right, well, these men are going to be behind their doors for 23 hours a day. Let's send them loads of distraction packs. We've later thought about it and we're like, actually, yes, distraction packs can be helpful in the short term, but going back to some of my other slides, we're going to be feeling emotions. So let's not just distract ourselves from all these emotions. So what we started to do is create handouts on mindfulness, on being able to validate that these emotions are normal. This is what you might be feeling, and this is how you can cope with it. So how do we do that? So by this caring mentality, we really need to respond compassionately. And sometimes within the NHS, you know, we respond with care, but we need to do this with wisdom. So just like I was saying about our distraction packs, they were our way to show that we care. But I guess the wisdom kicked in afterwards that we thought, hang on, we really need to think about, yes, we're caring, but let's have some wisdom where we're actually teaching people how to cope with this. So sometimes, you know, we see people saying a caring thing would be just to give someone a TV to cope with their mental health. Well, actually, no, what we need to do is not just give them distraction techniques. Let's give them a whole number of different ways to cope with emotion. So care alone can create dependence or avoidance of the emotion. So let's not do this out of our fears, but really focus on the measures that we're doing from a deep, compassionate part of ourselves where we want to help others. So there's often a confusion around compassion that is nice and cuddly and kind, which it is nice, it's kind, or people sometimes think it's about taking pain away. I guess within CFT, it's not about taking pain away, it's about alleviating pain and preventing pain through looking at the causes. It's also not submitting to the demands of others either. So if someone has got a problem, it's about listening to say, actually, what's going on for you right now? Let's listen, let's work together to work through this. So what we need to do is create the conditions for building courage, wisdom and dedication to face what we need to face. And I think one of the things that we really need to think about right now is that within all of this, we will have made mistakes. We will have done things which have caused problems for people, but we've got to make sure that we can put our hands up to say, look, in a way, our threatened minds are on. And when our threatened minds are on, what happens is that we don't think very clearly, because it's like that lion is chasing us. So what happens is that our attention narrows. So what we need to do is build space and time for reflection in order to think about how are we doing. And I guess sometimes, you know, I cringe at the government's response in a way, because they're kind of saying, yes, we've done this, we've done that, but not recognizing there might have been mistakes along the way, and that's okay. And I think we also need to kind of shape our media system for not then, if someone does say I've made a mistake, actually everyone being okay with that, because that's where compassion comes from. That's where we'll start to change as a society. So what we need to be guided about is concern for the well-being of ourselves and also others. And I think one of the things that I'm saying to my staff is actually look after yourself, because only once you've looked after yourself that you can then go and help others. So what we then also need to think about is ethics and having a good moral life as well. So in terms of research and compassion, actually the body is an extremely important tool that we need to look after. So when we're in a very competent, helpful, compassionate mind, as opposed to a very hostile, threat-based mind, what we know is that our gene expression is affected, our immune systems are affected. Now, if we're kind of thinking about some of the research that is coming out in terms of COVID-19, we know that those who are particularly affected are those with weakened cardiovascular systems, autonomic nervous systems. And actually there's various things that we can do in order to help that. So there's lots of research in terms of practicing compassion. And again, I'll kind of direct you to Paul Gilbert's website, who actually has got a more in-depth understanding of this in terms of his videos, but also does various practices that people can do to start to practice compassion, where you visualize things and that allows your body to rest. And actually then that wisdom will start to come through because your mind isn't so blocked. And I guess, again, the frontal cortex as well, we know it's not just practicing compassion, but also mindfulness exercises will help to slow the body down in order to think more clearly when our threat systems are on. So also, no, I'll come on to that later. So this is a nice diagram. So if we think about what starts to happen, we know that when our threat system is on, we are very judgmental, we don't notice, we can't reflect. We kind of are very impulsive in our behavior. But if we start to build this soothing, caring system of kind of sometimes deep breathing, and I've got a slide on how we do that physically. What we start to develop is skills in noticing, being mindful, reflection, holding and accepting different emotions, having empathy, being able to mentalize, being able to reframe, so being able to think about what someone else might be going through, because when we're in our threatened mind, it's very hard to do that, and therefore also then regulate our emotions. So one of the things that we really need to recognize is that there is a dark side of compassion, well, dark side of human nature. And I guess so what compassion is a sensitivity to the suffering of self and others. Whereas actually we know that as human beings, we can be extremely insensitive to the suffering of self and others. You know, we know in terms of sometimes what some of our clients have done, which means they were insensitive to the suffering, which has meant that they've ended up in prison. We also see that in various ways in terms of policy by government in a way that it's not always sensitive to those people suffering, and as a result we just then block ourselves away. And we see this regularly within prison, because actually if we started to get in touch with those emotions and started to recognize the suffering, well, actually we'd be an emotional wreck. So at times it can be helpful, but I guess we've got to make sure that we keep it in check, that we're recognizing harm being done. And I guess one of the ways that we can do that is start making sure that we recognize similarities within our outgroup. So those people who aren't necessarily in the group that we associate with, actually recognizing that common humanity that we have with them. And once we start to do that, we can start to sit in compassion. Again, develop that competence and wisdom, being appreciative. And I think the difficulty is what takes us more to the dark side is narcissism, empathy, and cost, you know, thinking about weighing up costs, really. So when we start thinking in money, sometimes we end up starting to be insensitive. Okay, so what we need to also think about is our emotions within our organisations. So thinking about common humanity, how are we in this together? Because again, our tribal minds might be kicking in now and again. So equally, like the virus itself, we don't want to contaminate people with our anger and frighten them in ways that are unhelpful. So thinking about actually what is the information you are passing on to others. So we've really got to think about how do we safely deal with our anger and frustration, and also recognise that might be coming out within our teams, within also the residents within prison. So we also need to think very carefully about our language. How do we communicate so people's threat systems aren't activated? So I know that Paul Gilbert has been talking about changing the language of, rather than social isolation and physical distancing, we're talking about being able to relate to others safely. So he talks about safe relating. So it's really important that we think about what language we're using that doesn't activate our alarm systems. And think about also, how do we communicate to people when this information is constantly changing? So thinking about dilemmas, I guess one of the things that we've been thinking about within our staff group are heroes. You know, dilemmas people are feeling is obviously tonight, again at 8 o'clock, people are going to, staff, particularly NHS staff, are being clapped. And I guess, you know, prisons haven't been mentioned. I think, you know, again, parts of society have been demonized, understandably, because they've gone and been selfish, they've gone and attacked people on the front line who've helped, but actually those people end up in prison who we are caring for. And I guess it's about how do we recognize that some people might not feel like a hero if they're unable to go to work, or also if they've got this mentality that I need to be a hero because I'm being clapped for, then what happens if you're struggling? Or also if you make a mistake, because Superman doesn't make mistakes. So I think it's really important to recognize that we are all fallible. And actually what in a way the NHS is being brought up to be at the moment is a bit of a hero. But what happens when we start to recognise that we're all human as well? So a really helpful term that is used in cognitive analytic therapy is the term of kind of thinking about scaffolding. So actually, how can we start to scaffold conversations? Because it might be that you ask your staff, are you okay? And generally normal response is, yes, I'm fine. But unless they're really, really not okay. But so therefore we need to sometimes think about, how do we invite conversations? How would you like to talk about what's going on right now? So really thinking about different responses that we can have. Validating that actually there's going to be many different responses. So whilst I've talked about sadness, anger and fear, there might also be guilt, there might also be shame. And there's going to be a whole number of different emotions, and I think we really need to recognise it's okay to not be okay. I've just had a message within our trust saying it's okay not to be okay. And I guess again, going back to my previous slide, sometimes within a very macho prison culture, that's generally not done. And I think we need to change that rhetoric, especially if we're going to start to try and be trauma informed. Recognizing how roles might have changed. So we might not have done those roles that we've done before. Again, invite conversation on how people are feeling about that. Thinking about just soldiering on, but actually exhausted. The whole kind of, it's interesting if we're thinking about, you know, what the government have been saying, and even the Queen's message about keep calm and carry on, the whole wartime rhetoric. Yes, those kind of ways are helpful, but we are not in a war at this moment in time. And I guess we need to really express ourselves in a safe way. And also people feeling guilty if they're putting themselves first. I think it's important to recognize how our threat system works, and actually if they are feeling guilty, how to talk about it, and then because if your health is going to be compromised, actually you're not going to be helping anyone. So it's really important to put yourself first and be compassionate to yourself, which will keep you full, which will allow you to continue to help others. So this is some slides that I know the BPS have done. So different phases of recovery. I'm not going to go through this because I'm just aware of the time and there might be some more questions. So we really need to think about protocols for normalizing distress. There's research to suggest kind of critical debriefs at the time are just very helpful. Later debriefs aren't, and actually they do more harm. So we need to kind of really promote safety rather than forcing people to debrief in a structured form, not to impose, but just to offer support. So not to say you will have this support, but to make sure that it's offered. Line managers and senior staff to make sure they can recognise when staff and residents are distressed and start to recognise the signs of trauma, and clear pathways to specialist services. We're going to need to think about within NHS organisations, but also we're going to need to think about how do we recognise those men and women, who've been affected within the custody. So different ways to do that. You might want to think about buddying people on shifts, having a group check out at the end of a shift, thinking about just managers that are trained to be able to, and staff generally. I think, you know, the trim package I think is quite helpful for this. So being able to normalise distress, making sure that we're promoting simple interventions, sleeping, resting, having a shower, eating well, all of those things, noticing and monitoring abnormal signs of distress, and rotating people with high and low stress roles. So also we need to think about what's going to happen over the next 12 to 18 months. I think one of the things that I've been thinking about, and I see this in terms of the clinics that I've run within prisons, is that normally when there's been a big incident, a number of people will refer themselves, not because of that incident, but actually the particular incident. So for example, COVID might trigger underlying trauma that people have just been coping with pretty well until this moment. So then, or they experience PTSD symptoms, depression and complex grief. And we might start to see that over the next 12 to 18 months. So this was a quote that I saw within the Prison Phoenix Yoga Trust, and it was just, how do we start to get people to change their perspective? And I just felt it was a beautiful letter, really. So a resident at HMP Risley wrote, "We are currently locked up 23 hours a day, being let out daily for exercise and the all-important phone call. So I've decided to expand my daily routine and treat the next few months as a retreat, making the most of my time with a daily routine. Morning prayer, meditation, breakfast, light exercise, lunch, reading, an evening meal and a longer evening meditation, an evening prayer, and writing a gratitude list of those things that I'm grateful for. This is semi-rigid but equally flexible. I need to be disciplined but equally need to be able to take away other activities, including rest, silence and yoga." So what we need to think about, unfortunately, for some reason, I didn't put this slide in. So we need to think about the vagus nerve. Again, there's some really good slides that Paul Gilbert's done, but actually we need to look after our bodies. So that previous question on how do we recognize our threat systems and learn to really calm them down. Well, we can do that but through basic things, making sure that we're eating well, exercising. So there's lots of research that actually just taking slow, deep breaths where our out breath is longer than our in breath can actually start to cause our vagus nerve to be on. And actually what starts to happen is then our emotion regulation systems start to become more regulated. Other things like hearing a calm, soothing voice, seeing someone smile, all of those things starts to actually de-escalate our body, so we're not in that threat system. Doing new things that we can start to feel a sense of achievement. Be aware of that negativity bias, but focus on the good and the compassion that is coming through. Keep in mind that this phase of life will end, and think about what you're going to look forward to when it does end. Also, for me, I know for me personally, I've kind of really thought about what do I consume that I don't need to consume anymore. So kind of thinking about putting a bigger perspective on this, using this as an opportunity to think about stuff. And from talking to various colleagues within HMPPS, we're not seeing necessarily high levels of aggression and violence because people are spending time thinking about the bigger picture, and that's really actually helped them. So I think that there might be a lot of hope within this. But before I go to hope, we need to think about the challenges. I guess we already know that there's high level of crime potentially being, in China, domestic violence and child sex abuse did actually increase during lockdown. We're going to need to think about how do we cope. We've already got an overcrowded prison system. How do we cope if there is a high level of criminal behaviour that is happening now, and when people then, if they are going to be imprisoned for that, how do we cope within the system? We also need to think about mental health services, because I really believe that a lot of unresolved trauma, thinking about poverty and those ACEs, that's going to come up, but also staff burnout and fatigue. So really thinking about, I know I spoke about exercise and breathing. Those exercises are going to be really helpful.
Just over 5 minutes left.
Yeah, sure. Okay. So we also need to think about hope and change. So actually, these are normal reactions to abnormal situations. And for me, I really hope that this allows people to recognize trauma, that we are, as a society, we're experiencing a level of trauma. And I don't want to discount the awful trauma that does go on, that people have experienced on the more extreme level, but actually by experiencing this as a society, people who haven't experienced the more awful, the really severe end of trauma might able to relate to what this is and how people react in, normal reactions to abnormal situations. So it also allows opportunities to talk and not bury things away, recognition of the difficult job done in prisons, but also new ways of working. We know that actually in terms of how our threat systems come on, there's lots of research to show that our guts get inflamed by poor diets. So I really hope we can start championing good nutritional food within our prison systems, because actually that's going to lead to people coping much better. They're not going to be as impulsive, and to recognise what's important. So some useful links. Here's the link of the videos that I mentioned. I also wanted to just commend the great work of the Prison Phoenix Yoga Trust. They've got some great handouts of different movements that people can do, some yoga poses and breathing techniques people can do in their cells or in their chairs, and it's a great resource which again will help people to kind of regulate their threat systems. So yeah, that's my email address, and I'm also on Twitter. So if there are any questions which can't be answered in the remaining few minutes that we've got, please do reach out. So I hope you found this really helpful, and thank you to those who will be watching this later on as well.
Okay, thank you, Sunil. We'll just go through a few questions. Do you have any thoughts about this in a forensic mental health setting? We are trying to balance risk, restrictions, mental health recovery and providing opportunity, all within the extra restrictions of COVID. Any thoughts appreciated?
I guess it's about going back to, again, the conversations that we're having. How do we really talk about what people might be experiencing right now? How is it making them feel? Because I think sometimes, especially as psychologists or even within wards and stuff, we might want to put lots of different activities in people's kind of repertoire, but actually can we start to think about how are they feeling, whether that's kind of physical sensations that they're feeling in their body, and just being able to name and label that, or being able to think about emotions. Now, people might not always have the ability to recognize their emotions, but there's lots of resources in order to think about actually showing them different faces, how might they feel, but also staff talking about how they're feeling. So again, modelling that way of thinking about what's going on.
Thank you. Can you advise on PPE? This is a physical barrier when trying to engage therapeutically with an inmate. How can you overcome this or adapt it?
I guess one of the things, so I guess PPE, so I'm a psychologist, I don't know the ins and outs, so I guess I don't want to kind of start saying things that you shouldn't be doing. But one of the things that I really want to think about is how can you still have a conversation at a socially safe distance? So if it is safe, then think about, do you need that PPE? So we know that from 2 meters. I think it's generally, if you're more than 2 meters away, I don't think you necessarily need that PPE, but at the same time, what we need to be doing, especially if that person is at risk of spitting or whatever, I really hope staff are protecting themselves.
Okay, do you think trauma will start to show later down the line when we start to go back to some level of normality in the world, when people have time to process?
Well, I guess one of the things, which is probably one of the slides that I kind of skipped, is whilst there will be trauma, we also need to think about post-traumatic growth. So we can start to introduce various things, like thinking about how do we have a conversation, because many people won't be experiencing any trauma symptoms. So we see post-traumatic growth being a big area of well-being, really. How do we take this as a learning experience of how to do something differently, so we're not repeating those patterns all the time?
In terms of not imposing but supporting, in the masculine culture, how do we support people who are not able to accept that they may need it?
I guess it's
amongst staff and residents, sorry.
Yeah, no, I think it's about how do we as leaders show that? How do we model that? So how do we share with our staff, do you know what, I'm really struggling? And sometimes, especially as leaders, we don't necessarily say that, but actually I think it's important that we model that we might be struggling with that, and that will hopefully start to change the culture, because if our leaders are doing that, then actually the staff will start to feel safe to do that as well.
Okay, we're sharing a globally traumatic event right now. Will this change our understanding of trauma? We will get a better sense of a reaction to a context rather than a disorder.
Yeah, and I think I've kept away from thinking about, well, I probably haven't used the word disorder at all, apart from thinking about PTSD as a diagnosis. But I think, again, what we need to think about is how do we recognise that these are normal reactions, just as, whilst I don't necessarily agree with the label of personality disorder, it's a way to cope with abnormal life events, which means that actually the ways that you cope meet criteria for a particular disorder. Okay,
we've just hit 5 o'clock, so would you like any more questions, or shall we close?
Are there any more?
There are quite a few. And there's quite a few lovely slides as well.
One last one then. I don't know if there's a theme with them.
Any thoughts on managing this for LD patients? We are seeing an increase in violence.
Yeah, I guess it's again just communication, lots and lots of communication. That's all I can say. I guess LD is not something I work a lot in really. So, but I'd just say lots of communication.
Okay, and we've got lots of comments from people saying thank you, they really enjoyed it and it's been excellent. And are you happy to share your slides?
I guess I might not be able to because I've taken some of them from the Compassionate Mind Foundation. But if anyone asks me, then there's certain slides I'm happy to share. Okay, brilliant. You've got my email address anyway, so yeah. Yes, and the RCGP have shared some of the yoga and movement resources from Phoenix on their toolkit as well online, so that's available as a link there if people would like it. But thank you, Sunil, for a really thought-provoking and informative session and for opening up discussion in this area as well. I think everyone's found it extremely beneficial. And as you said before, it will be shared as a recording, so if you know anyone that would like to watch it, then please do go on our website and it should be there the next couple of days. And keep in touch to see about any other webinars that we're running in the future. Thank you very much, Sunil. Goodbye, everyone.